Welcome to The Explainer. Today, we're diving into at-home fertility and pregnancy tests. Our goal? To give you, the pharmacist, all the essential info you need to turn those tricky patient questions into clear, confident counseling. You know this question, right? You've probably heard it a dozen times. It sounds so simple, but it's just packed with hope, anxiety, and a ton of confusion. This is exactly where you come in. You're the expert they trust and can actually talk to. Look, these kits might look like simple plastic sticks, but the science inside is incredibly sophisticated. And for your patient, this isn't just a test, it's a huge emotional moment. Your ability to break down that science and manage their expectations, that's what turns a simple transaction into real, meaningful patient care. Okay, let's start where the journey often begins for patients trying to conceive, figuring out when they're ovulating. We're going to break down the common at-home methods you'll get asked about over the counter. So, patients have a few ways to track their fertile window. Some use low-cost methods like tracking their basal body temperature or changes in cervical mucus. But a lot of them are going to walk right up to your counter and ask about the kits on the shelf, which usually means they're looking at urinary LH kits or maybe those saliva-based ones. And here's the most important thing you need to know. There is a huge difference in how reliable these kits are. When a patient asks which one to buy, you can give them a really clear, evidence-based answer. The urinary LH kits, they're incredibly accurate at detecting that key hormonal surge. But the saliva-based kits? Well, the data is pretty inconsistent. One study found they only matched up with ultrasound-confirmed ovulation about 37% of the time. So you can confidently guide them toward the much more reliable urinary tests. All right, let's shift gears from planning for a pregnancy to actually confirming one. If you understand the science happening inside that little test stick, it makes it so much easier to counsel patients on how they work and what the results really mean. You know, it's pretty wild to think that the earliest pregnancy tests involved injecting a woman's urine into a rabbit. We have come a long way. Even by the 60s, lab tests were still prone to false positives. But today, every single test on your shelf uses this highly specific third-generation technology. So what is a third-generation test? Well, it's a really elegant piece of science called a monoclonal antibody sandwich. It's specifically designed to find and grab only one tiny part of the pregnancy hormone, HCG. It's called the beta subunit. And that specificity is the secret sauce that makes modern tests so accurate and gets rid of those false positives from older tests. So here's how that antibody sandwich actually works inside the test. As urine flows across the strip, if there's any HCG hormone present, it gets snagged by a mobile antibody that's tagged with a dye. This whole package then flows down to the test line, where it gets trapped by a second fixed antibody. This action concentrates all that dye in one spot, and boom, you see the positive line. It's a really simple and brilliant little system. Now, to really understand when a test is going to work, we gotta talk numbers. In the very first week of gestation, HCG levels in the urine can be as low as 5 milli-international units per milliliter. That's our starting line. But from there, the level just skyrockets. It peaks around 100,000 just 60 to 70 days later. It's this incredible exponential rise that the tests are designed to pick up on. And it's exactly why timing is everything. And that brings us to maybe the most critical part of your counseling role: dealing with errors, those big accuracy claims, and just managing patient expectations. This is where you can prevent a ton of confusion and unnecessary stress. So we're back to that huge claim on the box, 99% accurate. Patients see that, and naturally, they take it as gospel. But you and I know there's a little more to the story. What does that 99% actually mean in the real world? Well, that 99% claim is usually based on lab testing the day after a missed period with perfect use. But real-world performance can be very different, especially when testing early. One really important study found that on the first day of a missed period, only 2 out of 7 popular kits were actually sensitive enough to detect most pregnancies. That context is so important when managing a patient's expectations about those test 6 days early claims. Okay, so what do you say when a patient gets a negative result but is convinced they're pregnant? You can run through this mental checklist. By far, the #1 reason for a false negative is just testing too early, before HCG has had a chance to build up. But it's also worth asking about simple user error, if the kit was expired, or if they used really diluted urine. Now, false positives are much, much rarer, but they are clinically significant. The most likely reasons a patient might see one are if they're taking fertility drugs that actually contain HCG, or if they've had a recent birth or pregnancy loss, because it takes time for the hormone to clear the body. And in very rare cases, certain types of tumors can also be a cause. Of course, fertility isn't just about ovulation. Male factors contribute to about 30 to 40% of infertility cases, so you're probably going to start seeing more questions about those at-home male fertility tests that are popping up on shelves. These at-home sperm tests are really just simple screening tools. They're designed to do one thing: give a positive or negative result based on whether the sperm count is above or below a single threshold, which is typically 20 million sperm per milliliter. And this is absolutely the most important counseling point you can make about these kits. A positive result only means the count is above that 20 million threshold. It says absolutely nothing about other crucial factors like motility or morphology, how well the sperm swim, or if they're shaped correctly. So a positive result is not a confirmation of fertility. It's just an indicator. Okay, that was a lot of information, so let's boil it all down into an essential, easy-to-remember checklist for those day-to-day patient conversations. Here are your top 5 go-to counseling points. Number 1, always advise using that concentrated first morning urine. 2, really stress how important it is to follow the instructions to the letter. 3, reassure them that even a super faint positive line is still a positive line. 4, help them manage their expectations around those early detection claims. And finally, number 5, if they get a negative result but still have doubts, the best advice is simply to wait a week and test again. So we'll leave you with this final thought. As these at-home diagnostic kits get more and more advanced, moving way beyond a simple yes or no, your role as the trusted interpreter, as the healthcare professional on the front lines, is only going to become more and more essential. Your counsel really does make all the difference.